Actually. So be sure to sign in if you did not already when you came into Airrosti. We'll keep that for our membership logs. We'll be doing a door prize drawing here in a little bit, and we'll probably just do that semi-randomly. And then, like I said, help yourself to lunch. Stick around after the meeting if you have time. Jamie's going to give some tours of the Airrosti headquarters. So if you guys are interested, if you haven't been here before, it's a phenomenal facility. So definitely stick around for that. If you have not already, please visit the Facebook page, visit the LinkedIn page, and follow us on all the channels. We do post there frequently, and that's how you can keep up with everything going on with San Antonio Liaison League. Go ahead. So if you are new to this group, the mission is to connect business development and marketing professionals, specifically in healthcare, to strengthen the network, share best practices, and share cross referral opportunities. So when having been in the healthcare business development space for almost 20 years now, I didn't see anything like this in San Antonio. There is a national organization, which our speaker is the president of, called the American Association of Physician Liaisons. And I wasn't familiar with that either. So it wasn't something that really was well communicated in San Antonio. And so I think this is a good opportunity for us to support each other, work together, when we can, and, further our profession. And like I said, our first meeting was April of last year. So we're just turning 1 year old. So we're still kind of a baby organization, but we're growing. Go to the next slide. So the goals of this group are to share contacts, identify networking opportunities, share industry announcements, share job opportunities where appropriate. If we have clients that we can refer to each other, we certainly want to do that. Continuing education. So we're always looking for suggestions for speakers or topics that you guys want to learn about. And then, like I said, cross referrals. So we won't, I think it's on the next slide. The membership is limited to healthcare business development professionals. So we won't allow professionals in other industries to be members. We're working on creating a sponsorship tiered platform where they can engage with this group, but from more of a sponsorship level. So this is the original steering committee. Myself as the chair, Tracy Garrett is with membership. Tracy's over here. Shane Carr is all things PR, marketing, and IT. That's our IT guru. Jennifer and Corey are not here today, but they work with Sally on programs. So this is just kind of the small group that has pulled all of this together, thankfully. We are looking to now add a treasurer to the steering committee. So if anybody is interested, please reach out to me or any of these individuals. As we have sponsorships and we look for support with expense like catering or venue, we hope to grow that side as well. So as I said, the membership is limited to business development professionals, marketing individuals, physician liaisons. We do have a membership database that we're maintaining on the website. So if you have not, you can visit the website and fill out that form. That will help us as we're building our directory as well to make sure that you're receiving announcements and meeting information, etc. Next slide. So these are the remaining meetings for 2023. The last one goes into 2024. So the next meeting is July 11th, then October 10th and January 9th. So like I said, if you have speaker suggestions, if you know of a great venue that might be interested in hosting us, if you have a company or an individual that has been a resource to you that you think might want to get in front of this group, certainly share information on sponsorship with them. And then if you're interested in volunteering for our treasurer position, we would love to have you as well. So we'll pause right now before we hear from Airrosti and before we present our speaker today. Does anybody have any announcements that they want to share with the group? Positions, industry changes, anything going on of interest? Events coming up? I know Shankar has one.
I have two.
Okay, go ahead.
Yeah. The first one is I am the chapter leader of the Free Market Medical Association here in San Antonio, and we have an event coming up on the 27th. It's going to be a good event, very good for people who want to understand what direct primary care is, because Dr. Wes Clements will be the keynote speaker. That's going to be at Club at Sonterra. And then the second announcement is that I have really focused a lot on helping people be visible on LinkedIn. And I have partnered with a woman who has over 1 million followers on LinkedIn. And we're going to do a challenge together, April 25, 26, and 27, 45 minutes each day. Her name is Shanae Moray, and we will be guiding people through that challenge so that you're not alone. So if you're interested in participating, speak to me after the meeting.
Awesome, thank you. Shankar is a LinkedIn guru, so if you are looking to grow your LinkedIn presence, he's definitely the guy to talk to.
Let's have one quick.
Yeah, go ahead.
I'm with the University Hospital in the Transplant Institute, actually. I don't know if you guys have seen or heard, but I don't know if any of you are in pediatrics or women care, but our Women's and Children's Hospital opens August. So you'll be seeing some public things out. We will allow folks to go in and see it. So I don't work with pediatricians, but pretty exciting.
That's good.
Yeah, where's it?
So Women's and Children's Hospital.
I'm on the foundation board.
Oh,
well, there you go. Where's it? Look, we have George Wanda speaking next week at Care Oncology.
oh, awesome.
Yeah, so he's from the Representative CEO.
Yeah, so is there another question? I'm sorry.
Where, yeah.
Oh, it's University Health Center, Medical Drive 4502. Medical Drive right next to, of course, we have several towers. So you'll see it. It will say Women's and Children's. We have like 3 towers there, right next to the main medical.
Great, thank you. In terms of events, we do have one of our clients is called the Bariatric Counseling Center. And they're located in the medical center, and they have an open house for providers taking place next week. It's the evening of the 19th. I think it's from 4 to 7. So the Bariatric Counseling Center is a behavioral weight loss program. It's not affiliated with any surgeons, but it supports the surgeons in terms of the mental health aspect of weight loss. So if any of your providers are in that space, primary care, lifestyle medicine, cardiology, that may have patients that would benefit from this kind of a intensive outpatient program, you're welcome to share that with them and encourage them to attend. The other thing, and Gabriel may talk about this, but AAPL, the American Association of Physician Liaisons, does have their annual meeting coming up in June in Denver. I think it's June 22nd through 24th, maybe. But I would encourage you guys to seek membership in AAPL and attend that meeting if you're able. I know Tracy attended the regional meeting in Dallas and said it was really, really valuable. So be sure and check that out. And I'll let him talk more about AAPL. Does anybody else have another announcement?
Yes.
All right, well, then we will move on. So I'm going to invite Jamie Carpenter to come up and talk to us a little bit about Airrosti. So we are super grateful that they have hosted us today. They have a beautiful facility. And if you're not familiar with Airrosti, Jamie will let you know.
All right, well, welcome to our facility. This is our Airrosti headquarters. So we're hubbed out of here. This is where we train all of our new providers that we hire. Our marketing, business department, everything's hosted out of this facility. I think we've been here about 4 years. The old facility we're in was off Bitters. We have locations all throughout San Antonio, about 25 clinics throughout the city and surrounding areas. We're all over Texas. And then we're also in 4 other states as well: Virginia, Washington, Ohio, and now Washington, DC. So we're rapidly expanding. We focus on, I think we have a slide, but the next slide.
Yeah,
perfect. So we're a healthcare company. Obviously, we focus on musculoskeletal conditions from head to toe, migraine headaches, neck pain, kind of all the way down in the chain to plantar fasciitis as well. So we hire chiropractors by trade. We also employ PTs as well. So our approach is just a little bit more hands-on. We do manual therapy in conjunction with exercise rehab as well. And we work with providers all over San Antonio, specialists. That way we can collaborate on patient care. So if we, are hitting red flags with our patients and not getting where we want to be, and our typical average is like 3 to 4 visits, then we're looking to collaborate and partner with other provider groups that we can send our patients to as well. So that's kind of it. Do you guys have any questions for us? We appreciate you guys being here. And like Michael said, I'm happy to give y'all a little tour afterwards if you're interested, but yeah. Thank you. Thank you.
So real quick, before I introduce Gabriel, I would love to go around the room. A lot of you have been to meetings before, so you may already know each other, but I know we have a few new attendees as well. So I want everybody to have an idea of who is making up this group. So let's start right here, if you don't mind.
Yes. Hello, I'm happy to be here. My name is Carly. I'm the Director of Marketing for San Antonio ERN Hospital. We're a micro hospital that's going to be opening up in June. You probably haven't heard of us yet. That's because outreach just started. So we'll be working with the larger systems, standalone ERs, PCP offices. So I'm excited to see what connections we can make.
What's the name of the hospital?
San Antonio ERN Hospital. It's a Nexus Health. They have around 22 facilities. We're adding 15 by 2025. Yeah,
Where's it located?
Vance Jackson and I-10, about 4 miles from the medical center.
That's where I used to live. Baby, go ahead.
I'm Tracy Garrett. I'm on membership here. I am with Genesis Care Oncology. We are one of the largest providers of radiation therapy in the United States. We have 2 offices here in San Antonio, one at the very first cancer center on the south side for radiation therapy at Brook City Basement, and one in the far lower east.
Hi, I'm new. My name is Tram. I work for TCP Health. We're a hospitalist group in town, patient placement. So basically, if you need a hospital a bed or whatever it is, you would call our direct number to our services.
I'm Esther Gomez-Wilson. I'm with University Health Transplant Institute, our transplant program there in the markets.
Hi, my name is Natalie. I'm with Airrosti. So we're here, do physician liaison type stuff with introducing our doctors to the providers in the area. So work with Jamie and everybody else right here.
Do their too. So her territory is mainly the medical center, and now she's helping out with Helotes, Bandera, Ellsman-ish area, right?
Yep.
I'm Amy Davila, and I also am a physician liaison manager. I help San Antonio and South Texas in the Austin markets. So I don't technically have a territory. I just help guide and keep some of the relationships I've had for a long time. So I've been working with Sally with a couple of her people too. So
Thank you. Shannon?
Hi, I'm Shannon. I'm a freelance marketing consultant. My company is called Industry Consulting, and I do everything from full scale marketing department to project-based marketing projects, primarily for medical clients, personal services, and hospitality.
Silver?
I'm Silver Lane. I'm with Tri-City Pain Associates, and we are throughout Texas. So I'm just the San Antonio physician liaison. I think we got 1 of 5. So I'm covering this region, and I believe we're going to be adding 4. Being managed, if I didn't say that already.
Justin?
I'm Justin Burgess. I work for USPI, subsidiary of Medicare, and have several facilities in town. We've got Foundation Surgical Hospital, Surgery Center of Bernie, and 2 de novo projects will be open soon, one in West Silver Hills.
I'm Anne Marie Ivy. I'm the partnership liaison for Foundation Surgery.
I'm Jenny Olm. I'm the principal and co-founder of Medical Marketing RX.
Sierra Cole, I'm also with Airrosti. I have more New Braunfels shirts, top 1 area for our clients.
I'm Caitlin. I am also with Airrosti. I'm in Alamo Heights, downtown, a little bit of Westover, and as far south as La Vernia and Floresville.
Jamie Carpenter.
also around. And I cover Bernie and Stone Oak and also work with our South Texas team. We have clinics down there in the valley.
It's something to be on.
Here in the surrounding area, about 25. Most of our clinics have about 2 providers at each. So we're up to around 45 doctors in San Antonio. And then as a company, around 250. And they all here. Jennifer?
I'm Jennifer Frank, and I'm one of 4 physician liaisons with Texas Oncology, and I have San Antonio West plus the Hill Country, and I am the liaison for our colorectal surgeons, which includes New Orleans.
Hi, my name is Gabby. I'm a physician relations manager and marketing specialist with Bariatric Consulting. So I'm with Michael.
I should have mentioned that we are also hiring. And boss is kind of cool. And if anybody's interested in very flexible physician relation, marketing specialist work, let me know. Go ahead, Linda.
I'm Linda Elliott, and I have a company called Healthcare Think Tank. We put on events, so I'm always looking for new ideas, and we're followed all over the country. And in fact, Michael came to me, that's how I know about this. And one of her clients was a recent speaker of ours about 2 months ago, the Bariatric Center. Very, very interesting. And this next, on the 20th, we have an integrated meeting. It's going to be here in San Antonio. I go from Austin, Houston, Dallas. We have Chapel Pittsburgh. And we have the 3 top leaders of public hospital systems. So George Fernandez will be there. We've got Red Cerise, the CEO of Parkland, going to be coming. And then Ishmael Corsa, the CEO of Harris Health. And they're all going to be talking about how healthcare has changed since the pandemic and what they've had to do in order to provide healthcare to their population.
That's going to be good. Sally?
Hi, everybody, I'm Sally Harris, the team marketing career specialist, and my referral development mostly is for orthopedic practice here in town. So I do a lot with Airrosti and providers do, I should say, and my family person uses Airrosti. So thank you. That's a lot. I'm Joanne Cueva. I do business development for PPA. Peripheral Vascular Associates. They're vascular surgeons. We've got 16 clinics throughout San Antonio and South Texas. The docs handle all kinds of circulation issues from, carotid artery disease, aneurysms, and PAD, which is very common in diabetics, which, as we all know, is very common here in San Antonio. So. I'm Sydney Kerr. I'm a clinical liaison for Nexus Health Systems. We're finally opening in our downtown location, almost 2 years of construction. So we've had some changes. We treat post-acute brain injury, but we're transitioning a little bit into more of the adolescent population. So specifically age 13 to 17 females, so post-acute brain injury. And then also which will be a residential treatment center will be doing medical. Right. Kind of unique for the area.
My name is Caitlin Tewksbury. I'm a community liaison.
Perfect.
My name is Kim Bachelor. I'm Jennifer Frederick is one of my partners. I'm with Texas Oncology. Texas Oncology is the largest provider of community-based cancer center in the state of Texas. We have over 400 physicians statewide, but here locally, I was trying to find the stats. We have approximately 33 physicians. And we have 4 comprehensive cancer centers. So I represent our San Antonio Medical Center location, where we have, again, it's our most comprehensive cancer center in San Antonio. We have several specialties under our umbrella, including surgical specialties, but I specifically represent our medical oncology and radiation oncology. I think this is a wonderful idea, so thank you guys for putting this together, because I know we can all, as we work together, we can all be better in our own.
Thank you. All right, thank you guys for the introductions. And if there's somebody that you feel like you need to connect with after the meeting, please do. We can also share the membership roster if you guys want to connect that way. I will move forward and go ahead and introduce our speaker. So Gabriel Flores has over 23 years of healthcare experience, including 7 years in an outreach and strategy role at Oregon Health and Science University. So that's why he's zooming in with us today. He's the president of the board for the American Association of Physician Liaisons, owner of Creatively Insane, host of the weekly podcast, The Shades of Entrepreneurship, and co-founder and president of the nonprofit Latino Founder. His free time, it's been being a girl dad of 2, and he just had a baby a couple months ago. So he might be a little sleepy, but he'll be fine. He is going to be presenting on all about budgeting. So this was a topic that was requested specifically, including developing a reasonable budget for outreach, who the budget is for, what it includes and excludes, and he will also provide an overview of AAPL and the benefits of membership. So without further ado, Gabriel, the floor is yours. Thank you for being here.
Thank you so much. I hope everybody can hear me all right. One announcement I actually did have, because you guys were mentioning announcements.
Are you unmuted, Gabriel?
I'm unmuted.
Okay, we can't hear you, so let me see what I can do there.
No problem. Let me know.
And if I need to take off the AirPods, let me know.
Can you try again, Gabriel?
Yeah, can you hear me now? Test 1, 2, test.
1, 2. Can you hear me now? Can you hear me now? Test 1, 2. Test 1, 2. Test 1, 2. Test 1, 2. Can you hear me now? Test 2, 1. Test
2, 1. Test 2, 1.
Oh, I can see the sound coming in here, but we have.
Can you hear me? Nope. Nothing yet. Okay.
Testing. Testing. Can you hear me now? Test.
I'm working on it.
That'd be nice. Might chip away at it a little bit more.
Sure.
Can you hear me now?
Yeah, so like every patient got I did it. Yeah, I do. Be that necessary work. Like no, like.
That's 1, 2. Can you hear me now?
I love it.
Sun car, can you hear me?
Yeah.
Does that work?
That's you're good to go.
We're good to go.
All right, guys, let's get this started.
All right, looks like we got the audio working. So good afternoon for everybody there in Texas. It's actually nice and, as you would expect it, rainy in Portland, Oregon. Yes, we do get a lot of rain, but it's also beautiful and green. One announcement I noticed you guys are making announcements. So one thing I did want to mention is there's also a national conference hosted there at Emory University. It's actually in a couple of weeks, so I'm sorry for the late notice, April 24th to the 27th. It's actually the NACCODA PANIN conference. So PANIN stands for Public Affairs and Marketing Network. This specific conference is held for cancer center development officers. So it's specifically for hospitals that are part of the NCI, that are NCI designated. So I know Texas Oncology was in there, a few other Texas folks. So if you have an NCI hospital and if you're not part of PANIN, I want to look into it. It's a really good group, pretty national, another national program like AAPL and others that are out there, just so you guys are aware. So I'm going to go ahead and share my screen here and we'll go ahead and get going. Perfect. Are you guys seeing the correct screen or the presenter screen?
Now we are, yes, it's good now.
Awesome, perfect. All right, so my name is Gabriel Flores, Provider Relations Manager at Oregon Health and Science University. Thank you again so much for allowing me to come speak with you today. If you actually attended the regional conference, there will be 2 slides out of the 24 that were in the same conference, so just bear with me on that. So quick agenda, what we'll be looking at, we're going to do a quick overview of Oregon Health Science University. Got to talk about the hospital real quick that I work for. Strategic brief. So before we even talk about budget, we're going to talk about some strategic brief. What are we asking for and why? And then we'll get to strategic budgeting. So what does the budget support, right? And who does it support? And then budget allocation. Who pays for what? I think it's really important to determine because there's sometimes multiple entities that are really working to help support provider outreach. And then lastly, we'll do a quick little overview of the American Association of Physician Liaisons. First, a quick introduction for myself. This is one of those slides if you've seen at the Texas conference. As I mentioned, my name is Gabriel Flores. I'm the Provider Relations Manager at Oregon Health and Science University. I'm also a business partner for Burnside Knives. We actually create local knives. The goal is to try to remove the stigmatism of knives being a weapon and trying to actually get it back to being used as a tool. Because in my culture, in fact, in Texas, I'm sure there's a lot of individuals with pocket knives, and we use them as tools very often. And so we're really trying to really create that. Latino Founders, as Michael mentioned, started that recently. We just got our 501c3. We have raised, I think we're at $65,000 right now, and the goal is to raise up to $150,000. We're actually a business accelerator program, so we actually help support underserved entrepreneurs build and maintain generational wealth. So we've been working that recently last year. It's been really fun. Again, American Association of Physician Liaisons. I am currently the president of the board. We do have the national conference coming up in June, which I'll speak about later. I also founded and the creative director of Creatively Insane Productions. It actually hosts and actually manages the Shades of Entrepreneurship podcast. Like many things created during the pandemic, I created the podcast to help support the Pacific Northwest entrepreneurs. We do a lot of interviews of local entrepreneurs, but a lot of national ones as well. Come out every Wednesday. If you're interested, please feel free to visit theshadesofp.com, but enough about that self-promotion here. All right, Oregon Health and Science University. So we are an academic medical center. We are based in the state of Oregon. We have about 576 licensed beds. We are currently creating another building. We also have a pediatric hospital. So the adult and pediatric hospital, all inclusive, is about 576 beds. We have about 420 plus 400,000 students and about over 19,000 employees. It looks like I did the bed count twice, so just so you really made sure you guys knew that we had 576 beds apparently. Pediatric hospital, again, we about have 600 medical students. About a quarter of all physicians in the U.S. pursuing pediatrics apply to Dornbecker Children's Hospital every year. So we have a huge presence. Almost every provider that practices in the state of Oregon probably trained at OHSU once in their life. It's really, really unique. Now, one other thing that Oregon has that not too many people, in fact, nobody has this, only we do. We're the only ones that won the 76-77 NBA World Championship. That is the Portland Trailblazers. That is the only championship we won, but we're going to go ahead and hang our hat on that for some time because we actually love our Blazers here in Portland. Okay. So before we can talk about budgeting, we kind of have to talk a little bit about strategy. So you kind of have to understand what your organization is, what you're doing, and it really truly takes the village. I really like this slide because it depicts what the organizations need to determine before the liaison can actually do some work. So first, the organization, identify what you are, right? Are you community hospital, surgery center, ambulatory center, academic medical center, health system? Now, in truth, OHSU is an academic medical center that is starting to transition into becoming a health system. So we are going through a lot of growing pains, to be honest with you. We brought in 2 community hospitals. We're very used to being academic medical center, education focused, but now we're bringing in community hospitals that are very population health focused. And so we're trying to learn that, right? We're trying to gain that value-based care initiative. And then priorities. Priorities are very important, but something the liaison cannot do, right? The liaison cannot determine what the organization is, nor can they determine their priorities. We can help support them and we can kind of help give our opinion, but most organizations, they need to figure out what their own clinical priorities are, utilizing contribution margins, capacity, staffing, community needs. Capacity and staffing are a big issue right now. I'll be completely transparent. We're trying to rebuild our advanced heart failure program. So we're doing heart transplants. I had one of the community hospitals, their executive leaders come up to our hospital, talked about our heart transplant program. About a week later, they referred a patient to us, a patient in cardiogenic shock. Okay, we'll get him in. We called them, said, we'll call you back in 4 hours. We'll have a room ready. 7 hours went by. We never called that community hospital back. So they referred that patient to one of our competing hospitals. Now, I always like to provide this example because we weren't ready operationally to grow. Sure, advanced heart failure is a priority, but we didn't have the capacity, nor did we have the staffing. So since we kind of put the cart before the horse, we unintentionally shot ourselves in the foot. And now to be honest, like it's happening right now, that community hospital is now in talks with our competitor to support their advanced heart failure. Boy, do I have yolk on my face. And again, we should have planned this out, but these are really important things because in the healthcare world right now, capacity and staffing is things. And if you look at healthcare 10 years ago, it was all about consolidation, right? The healthcare systems were starting. 5 years ago, it was all about volume. But now it's all about the right volume because we have this capacity concerns, we have staffing concerns. And so really making sure you understand where priorities are important. And then identifying your key stakeholders, right? The clinicians, the strategic managers, the operation managers, the marketing team, the outreach team, right? And all ensuring that they're all in the same line before you can even get to the planning stage. So today I'm going to be talking about the budget planning, and I'll also allude to the SWOT analysis survey. And then I won't be talking about the referring provider funnel today, but it's also something to kind of keep in mind when you're thinking about building a strategy. I actually will probably be presenting about the referring provider strategy at an upcoming virtual lecture. So if there's interested, I'll make sure your team is aware of that. And then lastly, follow up, right? So what does this look like? And so as I mentioned, before you actually start to create a budget, you really want to do a strategic brief. Now, I recommend no matter what provider reaches out to you, always do a strategic brief and ask some of these questions. One, what's the patient's journey, right? What is your referral process and how do the patients enter this program? Ask about demographics, ask about age. Is it primarily females or primary males, right? And then you can kind of generally get a sense of who that patient is. And then who of these patients typically get this type of treatment? Again, going back to that demographic question, right? Getting those ages, getting sex, getting maybe their ethnicity, right? And then who are your typical referring providers? This is a very good, important question because I think we generally assume like oncology. Oncology is a great example. I think most people assume that referring providers are primary care. But in the oncology world, it's actually the general surgeon for the most part. For heart failure, it's actually the electrophysiologist. I'm getting most of my volume from an EP because you're going to go see an electrophysiologist before you get your heart transplant. And so asking those questions is very important, right? And if you're a primary care, if you're helping a primary care provider, you may not have referring providers. Your referring provider may be self-referral. It might be patients, right? And again, understanding that is important as well. And then what is the goals of the program, right? Understanding like everybody has they want to create the and there's Department of Excellence, the Center of Excellence, right? Everybody wants to create the Center of Excellence. Everybody wants to be multidisciplinary and use all these fancy words. That's great, but what are your goals? What do you want to accomplish? Okay. And then what is the capacity and contribution margin? Understanding that is important because that will also help you as a liaison determine what volume should I be targeting versus not. Again, going after the right volume, right? For example, CAR T. If I heard some oncology folks, CAR T immunotherapy. I will take one CAR T patient over, a general medical oncology patient. I'm not trying to say I'm going to say no to these patients. Every patient deserves care, right? But when you're thinking about business development, or you think about business program development, you have to take contribution margins into account, okay? And then lastly, what is the timeline? Make sure you ask what their timeline and what do they expect, right? What do you expect to be seen? Because I think a lot of providers assume that liaisons have this magic kind of pocketbook in their wallet that as soon as they say, hey, I want to go see these 5 clinics, that the next week they're going to be all scheduled, right? And we all know that's not true, right? We have to connect with the clinics, see what their availability is, work with the assistants, right? Make sure everything's working well. So there's a bit of a process. And then last, how does this program relate to the overarching goals of the organizational strategy? I always save this question for last. And the reason I save this question for last is because no matter what, even if this provider or this program does not fall in line with the overarching strategic goals, we still have all this valuable information. So when this provider, when this provider or organization, they decide to kind of, it's time for their strategic goals to move forward. Hey, now we have all this information to move forward, right?
Let's see if it.
You just gotta hold it the whole time.
Any questions so far?
What did you just say?
No, you can continue, Gabriel.
Okay, perfect. Okay, expense allocation. So let's break it down to 4 buckets. Now, this is how our organization does it. I just want to explain that as well. Other organizations might do things differently, but typically there's 4 buckets: the outreach bucket, the marketing bucket, the service line bucket, and the organization bucket. And they each kind of have their own different allocations, okay? So you notice they kind of travel, air, exhibit fees in office, collateral, web and design, travel, air and conferences, PRM and CRM. So we're going to kind of go into this a little bit more in depth, okay? First, the department. What does the outreach primary care liaison department tend to pay for? In our organization, conference booth fees. So for example, if our department, like if our service line says, hey, we're going to go ahead and target primary care, okay, well, we're going to go ahead and find a couple primary care conferences annually, and we'll probably go ahead and budget for 1 or 2 booth fees, right? So we're saying, okay, we're going to attend 2 primary care conferences and we'll pay for these 2 booth fees. That's one thing we'll pay for. Branded table costs are very important. So if you notice this stunning young guy standing over here next to this table right here in the outreach table, that actually OHSU tablecloth is owned by our department. We do the cleaning of it. We send it out to the cleaners. We have one for pediatrics, one for women's health, one for cancer, right, with the different logos. And these are really important because they're really a hot commodity. Because like if you lose one, people are like always asking for them. Keep them with you. Outreach dinners and lunches, right? Scheduling an outreach dinner, knowing what outreach dinners you're going to be scheduling for the year. For some of you, if you do education, I know Michael mentioned education is a very big component of this group, possibly a projector. You may have to invest in a projector, right? If you don't have a laptop, that might be something you would want to invest in as well. Before, I don't think we do as much of the walking by clinics unannounced and just kind of knocking on the doors to introduce ourselves. We don't do that typically much anymore because the independents kind of are a bit of obsolete, right? But in the past, you might want to think about an iPad, right, to document that information while you're actually on the road. But then when you get an iPad, then you also have to think about the service fees and the monthly cost. So there's also those hidden fees that you want to think about as well. Now, outreach travel. Our outreach team will pay for the airfare and our outreach lodging, okay? So those 2 are important, okay? We'll pay for the outreach airfare and our lodging. And then we'll explain who else pays for the other ones. Now, liaisons, we also pay for our liaison business cards and our office conference supplies. Now, conference supplies is not marketing material. Okay, I just want to make that delineation. Office supplies are like the markers. If you need a power cord, if you need tape, right? Those are the office conference supplies, not the marketing material, which is going to be fact sheets, right? Fact sheet for us, what we call a fact sheet is take a clinic and say, I want to know who all of the providers are working for that clinic, the hours of operation, how I can refer to them, and what are those top referring like bullets. This fact sheet is going directly to referring providers. So you can use some pretty high level, healthcare jargon, because again, it's going to go to an actual referring provider, not a patient. Now, marketing also, they actually do fact sheets to patients as well, right? But they're going to be talking more about screening, prevention. The way you kind of, I'm not a marketer, but from what our marketing team kind of encourages us to do, is really try to explain it that a 2-year-old can understand it, and so that's the way we kind of try to create our patient-focused publications. Provider-focused publications are much different, right? A little bit more in depth, have a little bit more meat on the bone. Brochures. Now, our team actually has a program called the Traveling CME program. So we actually provide free education since we're in an academic medical center. We go out to our communities, we provide free education. And to be honest, this is like the second tier of the referring provider funnel. The first tier is awareness, right? We're just going to the conferences, we're doing cold calls, right? We're trying to just gain awareness. And what are we using? What marketing tactics? We're using fact sheets, we're using brochures, right? We're using provider announcement cards, right? We're just creating awareness of the program. But the one right before that, conversion, where I'm trying to get a provider aware of my program to converging to actually referring to our program, that I'm be using the Traveling CME program. Our Traveling CME program allows me to go into a clinic, provide a free education, have it CME accredited with AMA, PRA Category 1 CME credit for free. Well, what does it do? It gets our provider, our specialists in front of a room of providers, a room of referring providers to talk about our multidisciplinary team, educate the community. So what does it do? It helps the community, right? It helps their capacity, helps their acuity level, but it also creates this nice connection between our OHSU providers and the community provider, right? And so that's kind of getting it down to that conversion section. Now, again, marketing team, website design, digital, social media campaigns, provider directories. I know it's kind of weird, but I'm pretty sure some of you have the same experience. Clinics still really love provider directories, and they don't like the online version. They want the printed version. You're going to go in there, they're going to have an online directory. They're going to have, I still go into clinics and they have little, notes in their online direct or their physical directory from OHSU that we printed back in like '99 because it was so expensive to print and so on and so forth. But people still really, really enjoy that, and it's still really valuable. Now, social media. Now, one thing about marketing is very important. As you as a liaison, every single professional that works for a hospital is a marketing professional, okay? Let me give you a couple examples. So our War on Melanoma program. Now, social media it's pretty phenomenal. I mean, it's one of the only things that you can possibly have, an audience of 1,200 people or a couple million people at one time, right? That's the click of a button. So our War on Melanoma program, back in 2017, we created called the War on Melanoma. We declared war on melanoma in the state of Oregon because melanoma is the most preventable cancer, and Oregon actually ranks the top 10 in incident rates in both men and women in the entire United States. The reason for this, as I mentioned, we have a lot of rain, but we also have a lot of overcast. And so we assume, because we have a lot of overcast, we don't need to put skin care on, and so we have a lot of melanoma. So we created this War on Melanoma program, doing CME training with the tools and materials, all of these things. The first one in 2017, we did all right. We had 53 participants join the War on Melanoma. We got some studies, right? We got some saliva studies, we got some pedigrees, we got patients in. Not very much, right? So the next year we did it again. We got some CMEs again, we did a symposium. Now we're starting to get a little bit more traction. We actually did screenings at different locations. We enrolled different community members. right? We're like, hey, how can you help us build this program? Now, in 2019, we decided to do a little bit of a pivot. We're like, why don't we leverage social media? So we actually did a campaign. This is actually one of our patients, and this is her scar. Very beautiful photo, black and white. We really wanted to emphasize the scar, right? Because at the end of the day, no matter what you look like, you are still beautiful. And so we created this amazing campaign, and the attendance just kind of skyrocketed. The awareness of it as well. At over 1,500 total attendees, is about similar to what we had in 2018, except we have over 780 people attend the skin fair, 206 folks at the walk. And the beauty of this is during this entire time that we're doing, it was a co-event. So as our providers were getting a CME accredited melanoma lecture that was in person and online, we had our community patients hearing from a local dermatologist talking about screening and prevention while we had volunteers bringing patients at that event. So it was really, really cool. We got I think we got quite a bit of surgeries out of this patient, or out of this as well. Great brand awareness, right? Really cool program, but leveraging social media. And again, when we asked, so again, going back to social media, how did we leverage social media on this event specifically? So we created an OHSU Facebook event page. So it's specific about the war on melanoma. We did 3 posts on that. OHSU Dermatology has their own Facebook page that had 11 posts on that. And as you can see, we did a lot of takeovers on Instagram and different tweets on Twitter as well. We really try to engage the community about this event, and let's see if it worked. After the event, we asked individuals, hey, how did you hear of the Portland Skin Care Festival? Most of the people actually heard it from friends and family, and look at 13% specifically said they heard it from Facebook. More than the O2 internet site, more than an event poster or flyer, more than all these other things, Facebook was the driver. It was really, really interesting. Now, you notice right in the middle, it says skincare professional shop and social media. We actually outreached. So when you think about outreach, you think about melanoma, and you're thinking about referring providers, this is gonna be a weird one for you. We reached out to all of the tattoo artists. We reached out to all of the masseuses. Anybody that touched the skin, we reached out to them and invited them to this, because melanoma is the only cancer you can detect with your eyes. And those individuals work with people on the touch their skin every day. So we invited them to also join this program. And we really try to enlist them in, them being the champions of the war on melanoma. And even, let's see how we did. So again, this is looking at our incident rates in Oregon. I'm not saying that we are the direct contributor to this, but it feels really nice to see that our incident rates in Oregon and melanoma have declined rapidly since we have started to focus on it quite a bit, right? This is the data. I'm not sure of the recent data. I wouldn't be surprised if we saw a spike during the pandemic area, because I think most healthcare did. But we saw some pretty impressive declines in our incident rates in melanoma in all races, all sexes in the state of Oregon. And that was something that I thought was really, really cool. Now, as I mentioned, individually, you yourself, you are also a marketer. Here are some of the posts. I mentioned Shankar, I mentioned he's a LinkedIn guru, right? Leverage LinkedIn. I've got to tell you right now, folks, I'm actually currently right now in the final stages of a job position because of my LinkedIn post. People reach out to me and say, hey, notice you do this. Hey, notice you do that. And so leveraging these opportunities, tagging the folks that you work with so their brands also get recognized. But not only that, you're now leveraging their network, right? Every single one of these individuals that are blue that are tagged on these posts, their entire network see this post, right? So they get engagement with your post as well. And look at the views, it started out from 500 to 1,300 to 3,000, right? And it's slowly kind of creeping up as well. I would say my post now, I'm getting about 1,500 engagements per post. That's, again, as a liaison, and you can actually go through LinkedIn and look at who's looking at your post. About 40% of them are liaisons just like you all. So it really is interesting how it works. Now the service lines have their own budget as well. So a service line like cancer, cardiovascular, right, women's health, pediatrics. So those are service lines. They provide, now in our organization, this might be different than others. It's very important. This is what our organization does. The providers pay for their own air travel. So if they're going to be, now our liaison team will drive them to and from locations, right? So if they're close enough to drive, we will drive them ourselves. That is what we do, right? But if it's a flight, usually like, over 4 hours or maybe across state lines, those providers are expected to pay for that airfare. Now, provider lodging, this one's also another unique one, and so is actually travel, because some locations, if they're actually inviting your provider to do a speech at their location, you might want to ask them about travel reimbursement. Some organizations do have travel reimbursement. Well, they will pay for the provider lodging, they might pay for the airfare, right? Food reimbursement when applicable. Now, I always say when applicable because for the most part, if the provider's with the liaison, truly with the liaison's probably going to pick up the tab, right? And that's the bill that comes from us, right? We'll budget for that. If they're by themselves, for example, maybe you're double booked and you're unable to participate with an outreach event with one of these providers, the organization or the department should reimburse that provider for their meal, right? So if they're on the outreach trip, you just need to determine, is it the organization or the department that is going to reimburse it? Because the provider shouldn't have to, if they're going out to do an outreach for the organization, they shouldn't really have to pay for their own food during that time as well, right? They're doing work for the organization. Annual highlights and reports, we do that a lot. The service lines, we try to highlight what we're doing and why. Again, it's just kind of a annual, the year-end way to say, hey, look at us, these are all the cool things we've done. We're starting to do those virtually or digitally. I would probably recommend that because they're kind of expensive and they have big things. QR codes though. Anytime you go to a conference, hey, you want to learn more about our cardiovascular program? Flash this QR code. It's actually our annual report and it shows you all the stuff we've done in the last 2022, right? Service line conferences. This is a different than an actual, like a service line conference for us, OHSU, since we're an academic medical center, we actually have, cardiovascular for the primary care provider, right? That is sponsored by our service line, not the organization, by the service line. OHSU Hematology Oncology Update. Again, that is sponsored by the service line. So the cancer team pays for that conference, right? And they pay for that, and we will attend for free because they'll provide us a registration. But then ad hoc, I always add ad hoc because you always have new providers kind of come in, right? And they're gonna want new marketing material. But again, you have to kind of budget annually, right? And so if you have a provider come in mid-fiscal year, we kind of ask the service line, hey, if we budgeted for this, right? We budgeted for this, but now you're asking for this. That's something you're gonna have to take on. Once the new fiscal year cycle starts, we can go back and actually go through that process of budgeting again. But we've already kind of created the budget. So any ad hoc items must be paid through by the service line. And they're usually pretty good about that. And then lastly, the organization, right? What does the organization pay for? The good stuff, right? The PRM, CRM. We need the technical support. Benchmarking reports, we want to know how we're doing nationally. Like what is our strategic summary? What is our 2025? What is our 5-year vision? Travel reimbursement for mileage. Now, if you're driving, if you're using your own car, you should be getting the national reimbursement for mileage back, okay? Because usually they're not going to pay for your gas. They're not going to pay for you to get your oil changed. They're not going to pay for you the tire change. So they should be reimbursing for travel, and that should be the national rate for miles reimbursement, okay? So whatever that changes, I think it's something like 65 cents, or I can't remember exactly. But make sure you keep on top of that because that should be the organization. Because again, you're working for the organization. You're helping provide profit and revenue for the organization, right? Phone reimbursements. If you are using your own personal cell phone, make sure you're getting a stipend back for your cell phone. Or if they have a company phone, right? If you're using your own personal phone, I would not anticipate that you're going to get your full entire phone paid for. They might pay for a percentage of it, or maybe like a $50 or $60 stipend. But if you're using a company phone, hey, that should be completely paid for, right? And then brand campaigns. Brand campaigns are usually like, more focused on the building the strategic mission, the brand, patients really focus kind of communications as well. The online presence in regards to the software, the IT of it. that's really where the organization kind of comes in and builds out their kind of their budget. Now, again, none of this is possible without the strategic planning. You kind of have to have the strategic plan in place because, again, budgets, especially liaisons budgets, we're getting like pennies on the dollar, right? We're expected to get a penny and make it stretch to be 1,000, right? And it's true, we're really kind of, it's very difficult, but if we plan correctly, right, with the senior leaders, encourage them to make the strategic plan and kind of use a weighted system. Now, how I use a weighted system for strategy is I'll say, hey, do you think heart failure, so think of cardiovascular, do you think heart failure is more important or is aortic more important? And then which one? Is it 5? Is 5 heart failure or is 5 aortic? Okay, if you say it's 5, the heart failure is 4, okay. What market is more important? Is it this market or that market? Okay. So when they come back to the organization and says, hey, these are street parties, we have a new provider or a service line, because, hey, we have a new provider, we got to do this. Okay, how does it align with the strategic priority and the weighted system? So now you're not being the bad guy saying, hey, the liaisons don't want to work with me. They're like, we're trying to follow the strategic plan because everybody likes to go rogue and try to do their own thing. But at the same time, we have to kind of maintain the strategic plan because you don't want to end up like Gabriel Flores, bringing up an executive from a hospital only for you not to get that patient in. And now you unintentionally probably walk them into your competitor's arms, okay? Don't do what I did, right? Learn from me, don't do what I did. Now, the last thing you kind of want to do, now that you've identified your budget, you're ready to start planning outreach, okay? SWOT analysis survey. This is one thing I use often. I actually do this like on a Survey Monkey. So it's blind, so nobody knows who's asked or answering the questions. And I'll send this out to the providers and to the medical director and say, okay, we're going to do this SWOT analysis for this specific program, right? CAR T, we're going to grow the CAR T program. We'll get the CAR T team in the room and say, answer these questions. I send this to them a week or 2 before I meet with them. I want these questions answered before I meet with them. So when I meet with them, I know, okay, you're saying these are your top strengths, your weaknesses, these are some opportunities that exist and some threats that exist, okay? Now, the reason I want to do this is I want to try to find, we usually have an hour, right, of time with the providers. So do a lot of this pre-work because then you can kind of identify, okay, here's some of the common things we're hearing. This market seems to be where you guys are getting falling from. This is your opportunities. Here's our biggest competitor, right? And then the last one, how do you envision the department of the future is really important because then you can kind of get a sense of where your provider wants you to go, right? I think it's very often where we have the difference of opinions between administration and providers. And sometimes as a liaison, you kind of have to be the conduit between both, right? Because we really do kind of think about our provider well-being and making sure they're okay, making sure they're not burning out, And so understanding what their vision is for the future is very important because it also makes them feel invested in the growth of the program. If you're asking me how I want to build something and then you're engaging me in building it, you bet your bottom dollar I'm gonna work my butt off. But if you're coming to me and saying, hey, this is what we're going to do, and this is how we're going to build this program, and I had absolutely no input in it, it's going to be kind of tough for me to really, really be engaged in that kind of work. And so that's one way to kind of engage your providers. Now, lastly, I kind of wanted to just talk about the AAPL membership just briefly. This is not a sales pitch at all. These are just some of the resources they have. So if you are interested, by all means, join. If not, there are so many other phenomenal groups like the San Antonio Liaison League is one, Fishman, Pan-Am. There's a lot of great professional groups out there. Some of the resources we have is a resource toolkit. It has pre-planning worksheets. So if you're going to go to a clinic and you want to prepare yourself, we have a mentorship program. We do provide free webinars. We do also do job postings, sample job descriptions. Now, one of the most important things I would say that AAPL probably has the most useful and valuable thing, in my personal opinion, is the benchmarking survey. We're going to do it again next year. We actually survey all the AAPL members. We're at almost 400 members right now. And essentially what this does is gives us how many liaisons are in your department, who do you report to, what's your pay, what's your title? I use this every other year. I go back to this benchmarking survey and tell my providers, hey, because I report up to a provider and say, hey, the benchmarking survey says this. The folks in the Midwest that are program managers are making $30,000 more than I am a year. I'm on the West Coast. My cost of living is much higher. Guess what I got? 30% raise. Use this. Use the benchmarking survey. If you have the opportunity to use this information, use it. There's absolutely nothing out there currently for our profession I'm aware of. And then obviously, networking, national conferences, regional conferences. As you mentioned, we did the San Antonio one. We have the June conference coming up in Denver. I will be out there, so I'm very excited. If you guys are attending, please hit me up. I'll happily buy you a drink. Leadership development, professional growth. We have connected with a professional team, the American Society of Pathology Institution. It's basically the career advancement. It's called a CI program. And so you can actually go through these trainings and you'll get actually a certificate that you can take back to your organization. And then we recently started creating these special interest groups, manager directors, pediatrics and oncology. And I think a cardiovascular is going to be probably coming down the pipeline here soon. So that's American Association of Physician Liaisons. If you're interested, you can certainly check out AAPL for more information. But again, it's not a sales pitch, just some valuable information. I just wanted to leave you with this little quote that I thought was kind of indicative of what liaisons are. Leadership is the capacity to translate vision into reality. Because in truth, it's what we do every day that makes a difference in people's lives. Whether it's environmental services cleaning up the lab, whether it's a physician liaison taking a referring provider, or a food service person keeping the food warm, it's what we do every day that makes a difference in a person's life. I'm not sure if you guys noticed it, but when you walk into these hospitals, everything that's at home stays at home. Because these people that are here in our hospitals, they're here because they need to be. We're here because we are paid to be. So remember, we do not know these individuals' backstories, and they may have a tough day, right? Usually it starts first thing in the morning, you spill coffee on yourself, or you can't find your keys. But remember, as Maya Angelou once said, they may not remember how you feel, they may not remember what you did, they may not remember what you said, but they will always remember the way you made them feel. So my challenge to you today is, as you walk around, look up and smile. Try to make someone smile, because it's what you do every day might make a difference in somebody else's life tomorrow. Thank you again so much for the opportunity. Gabriel Flores, I'm Provider Relations Manager at Strategic Outreach at OHSU, also the host of the Shades of Entrepreneurship, the podcast. I would love to connect with any of you guys. Thank you again so much for your time. I really do appreciate it. Michael, thank you again for allowing me to present to your team. Really hope you found this valuable.
Thank you so much. We really appreciate it. Does anybody have any questions for Gabriel? One thing that I wanted to kind of circle back on, you mentioned, weighting the different priorities of the strategic plan and then budgeting according to those weights. And that kind of, in my mind, that's kind of an objective way to get around positions or leadership or whomever that have shorter term goals that they want to kind of throw dollars at when it's outside of the strategic plan. Do you feel like that helps that conversation? And do you feel like those ratios have changed post-COVID with where your dollars are being budgeted?
That's a great question. I think it's a little bit of both, to be honest with you, because I think a lot of the providers that in the beginning had that little bit of time to maybe create that little offset, like cardiovascular is a great example where we're trying to create the 3D imaging, 3D MRI imaging, right, to help support cardiovascular care. Before the pandemic, we're all for it, but I think now we're starting to basically kind of fall back onto our core competencies, because those are the low-hanging fruit. And I think with finances being the way they are with a lot of organizations right now, you're going to probably see most hospitals kind of fall back on their loins a little bit and focus on their core competencies versus start a new program right now. That's what I'm seeing, at least on the West Coast. I'm hearing it's probably the truthful over in Stanford and Hopkins. So it sounds like other locations are also feeling that. It'll be interesting to kind of see, because to your point, like, I don't want a new provider to come in with this great idea and have some funding, like especially if they got grant funding or something to do it, and then it's not part of the strategic initiative. because then they just completely feel, isolated, right? And not supported. So it's a very fine balance, I think, that we're seeing, but we do see it. We're starting to see organizations kind of fall back on the core competencies versus, hey, let's start this new program, mostly because of the staffing and capacity issues and a bit of the financing as well.
Yeah, I agree. I think post-COVID, we are doing a lot more in the digital space than, the hard copy collateral and tchotchke and, exhibit fairs and that kind of thing. But it's a mix of both. And, you said in the very beginning that maintaining the personal aspect of outreach is really important. And that's something that we've talked about in this group before is, are we going, our physician liaisons going to be made extinct by things like Patient Pop or Google Ads or, other review volume ROI generating AI, really, right? But I think there's still a lot of value of that boots on the ground, in-person relationship building that we do. So I don't think that aspect of it is going away anytime soon. But it does make your budgeting look different when you're doing more, so virtually and remotely and all. So that's interesting. Anybody else have a question?
Michael, I actually wanted to kind of follow up on what you just said, because I think you made a pretty big point. So when you mentioned value, I think so you mentioned, possibly these AI things coming in, and it's true, right? AI is coming and we got to kind of be ready for it. Now, as liaisons, as professionals, we have to find ways to create value, the perception of value. Let me give you a great example of how you create a perception of value. When the iPod first came out, the marketing for the iPod was simply the photo of the iPod, and it said 1,000 songs in your pocket. That's all it said. That created value, right? That was value. Because what do we have before then? We had the Walkman, we had the CD disc, right? So we're creating a value back to a consumer. So as a liaison, as referring providers, find ways to create value back, right? How do you create value or the perception of value? Maybe it's access to the provider quickly. Maybe it's access to you quickly. Maybe it's access to a specific resource that they need that they didn't know they had, right? Just figure out ways to create value, because Michael's right. I mean, you're going to probably see AI and technical things come down the pipeline that are going to disrupt our profession. But as individuals, nothing's going to take over the personal connection that you can make, right? And that's probably one of the most valuable things you can kind of provide. But then also utilizing those opportunities when you're making great relationships to feed back this valuable information to your organization so they can help establish that strategic plan is really important. But again, just figure out ways to create value back to either your organization or the referring provider or your provider that you're working with.
Yeah, that's a good point. Well, thank you so much. We really appreciate you. Enjoy your cooler weather in Oregon.
Oh, yes. Enjoy Texas. Hopefully I'll see you guys in the conference. And if not, hopefully I'll see you around. And please feel free to connect with me on LinkedIn. I'm always happy to support professional development and try to, lend my education and experience to anybody that's willing to listen. So thank you again so much for the opportunity.
Thank you. And I was wrong on the date. So it's June 20th through 22nd in Denver. I said 22nd through 24th. I mean, who doesn't want to see Denver in June anyway? Okay, so
I'll give you a free drink. So if you find me, I'll buy you a free drink.
Thank you so much.
Have a great day.
So our next meeting, as I said before, is July 11th. But we have had interest from you guys to do something in the evening because lunch hour